I was always very passionate about helping more of the vulnerable people in our communities. So that's why I chose Pitt, because I knew that they would lead me to those connections.
I wasn't really sure what direction I wanted to go into. I ended up doing a summer program in public health, and that was my first exposure.
I like the idea that you can mix science and public health and public policy into one thing. So if you're really interested in science, but you're also really interested in social studies and humanities, you can mix it as one in public health.
So I chose Pitt Public Health because of its connections. The School of Medicine is right across the street. There's the VA up the hill, UPMC, and just lots of opportunities for research or different subjects.
Public health itself is about life and people, right? So life and people are everywhere, which means that I would be able to have a degree that would allow me to define my own path. It's a very real degree. The work is relevant and important to improving the state of our society.
Going to Pitt Public Health prepared me in a lot of different ways. The technical skills, the programs and software that we use, but also the connections.
The things I appreciated the most about my experience at Pitt Public Health was just the relationships I built with my professors.
They care so much about us, and they provide so much great knowledge.
Faculty are world-class. The research that they're doing here, the faculty are very open to exploring new avenues with their research.
Pitt is still small in the class sizes, and the professors give you individualized attention, so that gives you more opportunities to get involved in projects.
The people here, I found my people. I found a community that we could co-learn together, support one another.
The people were so nice and friendly. I knew I would fit in really well. And Pittsburgh has been my home for most of my adult life, so it just felt like a good fit to stay here, especially because the cost of living is so good.
It was hard to leave Canada. I love going back, but I also think the opportunities here are kind of different and in some ways a lot better.
The things I really appreciate about Pittsburgh are just its uniqueness and a very unique sense of community that I haven't experienced in other cities that I've lived in.
Oakland, I feel like, is the heart of campus. There's just so much going on.
I mean, it's a great city. It feels a lot like a community. There's just an abundance of opportunities.
Great to get around, and I love that you have like a big city feel, but also the smaller neighborhoods.
We have the Steelers, we have the Penguins, and I love hockey. I love baseball with the Pirates. All of the museums around here.
The programs here are rigorous and challenging, but you feel empowered to get through it because you know you have the support.
It's so close to hospitals and different labs that I'm able to have the opportunity to go to any of these places to do my rotations or to work at.
Because there's a placement with UPMC through my program, it sets us up nicely to work there in the future.
Yeah, UPMC has world-renowned care, and they have expanded across overseas, even to Ireland and Italy, and also are expanding into other states. So there are a lot of opportunities for students to get involved in different areas.
We get the world-class instruction, but we also benefit from the world-class research.
I think you should come to Pitt Public Health just because of the strong sense of community and support that you'll get here.